Just 1 second. Am I the co-host? I think I'm not able to share, so I'm not sure.
Sir, you will share your screen once Bhavani will stop sharing her screen then.
Okay. So sorry. That's fine. Lovely. Yeah.
Hello, everyone. Sir, Dr. Rohit Modi is host of the event today. And Rohit Modi has more than a decade of experience in providing high quality eye care to his patients. And he is one of our ambassador of Mumbai City chapter, Pan Mumbai City chapter, and he is uh, also very good speaker. And I'm really happy and I'm really glad that he accepted to host this event. Over to you, Dr. Modi, sir.
Well, I would like to invite the our chief guest for today, Dr. Sunil Kumar. It's an honor, sir, to
Thank
have
you.
you on our platform. Sunil Kumar is an anesthesiologist and foundation year doctors program director at University Hospitals of Buckham Bay NHS Trust, UK, a board certified lifestyle medicine physician both in US and UK. He is also a lifestyle medicine lead tutor at the WHO Collaborating Center, Imperial College, London, and serves as an advisor on lifestyle medicine in pre-rehabilitation at the Center for Perioperative Care. He is a council member at the Royal Society of Medicine, ambassador and lead for lifestyle medicine at the Personalized Care Institute, and faculty for NHS England, the University of Thessaly, and the European Lifestyle Medicine Organization. Along with that, he is a best-selling author of The Power of Self-Care and The Power of Preparation of Surgery. I would really recommend personally for all of you to read The Power of Self-Care. I found that book transformative. Dr. Sunil Kumar is a founding member of the Global Wellness Institute Lifestyle Medicine Initiative and a member of Forbes Coaches Council. He is a nationally recognized award recipient for physician well-being workshops and a sought-after keynote speaker at international conferences on lifestyle medicine, prehabilitation, and healthcare transformation. Over to you, sir.
Oh, thank you so much, Rohit, for such a kind, generous introduction as well. And yeah, let me start sharing the screen. And I'm not able to. Okay. Can you all see my screen?
Yes.
Yes. Yeah.
Can hear me as well. That's fine. Okay.
Yes.
Okay. So we're talking today about power of personal transformation through lifestyle medicine. So it's basically from burnout to balance to becoming. That's the main theme of the talk today. And as already Dr. Modi has introduced me, and even though I'm so affiliated with so many organizations, my intention and the current presentation is from my own experience and from all the knowledge and skills I have gained through. So it is nothing to do with the affiliations of any of these organizations. Just a disclaimer to start with. So let me start with a stark truth. I think 1 in every 4 doctors in India faces burnout now, as we all saw recent newspaper article as well. I think a couple of weeks ago or something, or last month. And again, I mean, that's not just a statistic, is it? That could be any one of us in this room as well. So this isn't some distant problem. It could be our colleagues, our friends, or our teams in which we work. And sometimes it's us as well, including us. So this number came from a nationwide survey which was done in India for over about 760 healthcare practitioners, which showed that 25% experienced all the 3 dimensions of burnout, like personal dimension, work-related dimension, and patient-related dimension. And that means exhaustion was there at home, stress at work, and even compassion fatigue with patients as well. So this is why we need to move beyond just acknowledging the burnout. We need to fundamentally rethink how we look after ourselves and our profession. Now let's look at the evidence over time in India. Now, because burnout among healthcare professionals in India isn't just a recent discovery, it's been well documented. Like back in 2020, a systematic review and meta-analysis of 15 studies with nearly 3,800 participants found that, again, same numbers, 1 in 4 healthcare professionals experienced burnout. The risk factors mainly were very much clear: younger age, women, being unmarried, long hours, low pay, lack of respect, and poor sleep. I think we all know these risk factors already anyhow. Now then came the COVID years. Like by 2024, a cross-sectional study post the third wave of COVID wave found that burnout skyrocketing to 68%, which is like 7 out of 10 people. Imagine 7 out of 10. That's more than two-thirds of the healthcare workers. Work-related burnout was especially high at almost 68%, followed by personal and patient-related burnout as well. Now, nurses, physiotherapists, and residents were also hit the hardest. Now, in 2025, the recent study which we discussed in the last slide, again, that was a survey of about 763 patients. Again, that gives us an updated picture. Nearly half reported personal burnout, a third had work-related burnout, and over a third had patient-related burnout as well. What's striking is that 1 in 4 experienced all three types simultaneously. The risks remain consistent, but young doctors, women, night duties, and inadequate sleep, especially less than 6 hours of sleep. But there's also a hopeful finding here. The protective factors like exercising even for at least 45 minutes a day and maintaining adequate sleep significantly reduce the burnout risk. So the story here is very clear. Burnout is not only persistent, but it has escalated with time and stressors like COVID as well. But equally, we are identifying modifiable factors, the things which we actually can act upon. Now, when we talk about burnout in India, we must recognize that our context brings unique risk in addition to all other risks every doctor in the world faces. This amplifies the problem even more. Firstly, the critical shortage of doctors. I think our doctor-patient ratio stands at about 1 in 11,000, shockingly below the WHO's recommendation, which is 1 in 1,000. So we are actually looking after patients 10 times more than any other part of the world or with the WHO recommendation. That means every doctor is shouldering the workload of at least 10 colleagues. So second, the excessive workload. It's not uncommon for doctors to see that more than 40 patients a day or maybe even more. I don't know because I haven't been in India for the last few years now. So in addition to long hours and repeated night shifts as well. Now, this isn't just tiring. It erodes both mental and physical reserves. And thirdly, the system challenges. Obviously, we all know doctors in India often face poor recognition for their work, inadequate insurance coverages, and sadly, even incidents of violence from patients or their families as well. Now, these systemic issues make the environment not only stressful, but unsafe at times as well. Now, this isn't just stress we're talking about here. It's an unsustainable way of working. And yet, as professionals, we carry on often at the expense of our own health. Now those were the numbers from India. Now this one, if you look at these numbers, we'll look at American numbers because these are the numbers from the Medscape report which came in 2024. And Medscape report is a very good report to follow about doctors' health, which is conducted in America, where they involve all the physicians, all the doctors throughout the US, right from resident level to the consultant level as well. So let's take a look at this physician burnout trends by gender over the last several years. As you can see here, although I mean everybody, all men and women both have been increasing or kept stable at same rate of burnout, but if we can see, female physicians consistently report higher levels of burnout than their male counterparts. In 2018, 48% of women reported burnout compared to 38% of men. Now, this gap has remained relatively steady but widened significantly in recent years. The peak disparity occurred in 2023, where burnout reached 63% in women versus 46% in men. Even in 2024, despite a slight improvement, 56% of women still reported burnout, is 12% higher rate than men. This tells us two things. Burnout is rising in both genders, especially post 2020, but the burden is disproportionately higher for women in medicine. Why might that be? I feel personally it could be because of dual role they play. They are clinical as well as caregiving responsibilities at home. Systemic issues like gender bias, lack of mentorship, or even the microaggressions which they face, then emotional labor and higher expectations of empathy or compassion. So this slide is a call to action for more gender-sensitive burnout prevention strategies as well. One size fits all doesn't work. We need targeted interventions, especially for women in medicine. Again, this slide is from the same study that reveals a troubling pattern. Like the burnout isn't just a fleeting issue for most clinicians. Let's walk through this data. Like 0% reported feeling burnt out for less than a month, which means acutely they don't feel it. This highlights that burnout often isn't a sudden, short-lived episode. Then 9% have been struggling with burnout for 1 to 6 months, and 20% have experienced burnout for 7 months to a year. 29% it has persisted for 13 months to 2 years, and 42%, the largest group, have been living with burnout for over 2 years. This is the data from all the doctors from America and Medscape report in 2024. It's not old data, it's quite new. So can you imagine this? That's nearly 3 out of 4 doctors feeling burnt out for more than a year. Now, this data shows burnout is not just an episodic exhaustion. It's often a long-term unresolved experience. If it is left unaddressed, it can become embedded in the clinician's identity and daily functioning as well. So this calls for early identification, not just crisis response, long-term support strategies, not just one-off wellness session. A shift from short-term resilience hacks to deep systemic and lifestyle-based change has to be applied. When we see burnout persisting for this long in such large numbers, it's a clear signal that the system isn't just cracking, it's leaking energy continuously, and we need to seal the source. This one of the slides, again, there are plenty of slides from this study, so I don't want to put everything here, but this is the last one from that study. So this slide reveals a stark truth again here. Most physicians don't seek professional help for burnout or depressions. I'm repeating this line again. Most physicians don't seek professional help for burnout or depression, including all of us here. Only 15% sought help for burnout and 11% sought help for depression. 17% had used help in the past, but they're not currently engaged with that help. The most concerning figure from this data is 53% said they have never sought any help, past or present, and 8% preferred not to answer, possibly indicating stigma or discomfort. These numbers underscore the cultural barriers in medicine: stigma, fear of judgment, licensing repercussions, or the mindset of self-reliance as well. Now, as a community, we need to normalize seeking help, embed the psychological safety in our colleagues and ourselves, and ensure that physicians don't suffer in silence. Now, again, this is from JAMA article. This is one of the most powerful graphics I have come across in burnout literature. The JAMA study used the validated Connor-Davidson resilience scale and showed an astonishing inverse relationship between resilience and burnout. What does that mean practically? For physicians with raw resilience scores, over 80% experienced burnout, which we all can understand. But among those with a high resilience, only about 30% did. What I'm looking at here is, look at the emotional exhaustion and depersonalization panels here. Again, significantly better outcomes with higher resilience. Now, this data doesn't just highlight the problem, it shows us the way forward. If we invest in building resilience, we can prevent burnout on a large scale. Again, one more sentence I want to come back to you again is that the people with a higher resilience, only about 30% did experience burnout. So what I'm saying is, most of us doctors are with a higher resilient power. Even at the highest resilience, we still face burnout at least 30%. So you can imagine. So again, what is the cost of burnout here? Burnout doesn't stop with the individual doctor. It has got a great ripple effect spreading across patients, teams, and the entire healthcare system. On a personal level, it raises the risk of depression, anxiety, cardiovascular disease, and even substance misuse. It's not just about feeling tired, it's about long-term health consequences as well. So in addition to all the Asian risk factors we face, or Indian risk factors we face for the chronic diseases, this is an additional risk factor for being in the profession as well. So imagine, on a professional level, burnout leads to more medical errors, less empathy, and lower patient satisfaction. So when we are running on empty, we can't give our best to our patients. Again, coming to the system level, the burnout fuels absenteeism, like you don't turn up to the work. Presentism, you turn up to work, but you're not actually giving out the whole intensity of work you can actually do, and ultimately attrition as well. So draining the workforce and weakening the entire healthcare system. So when a doctor burns out, everyone suffers. This is why tackling burnout is not just about personal self-care; it's a public health priority as well. So what is burnout? Again, burnout has been defined by various people differently, but burnout is often misunderstood as simply being tired or overworked. But it's far more than that. WHO recognizes burnout in the ICD-11 as a syndrome. Syndrome is a constellation of symptoms and signs, isn't it? It's a syndrome specifically caused by chronic long-term work, unmanaged workplace stress, unmanaged. Yeah. So it's an occupational hazard. Now it has three key dimensions. One is exhaustion, second is cynicism or a depersonalization, and number three is inefficacy. What is exhaustion? Now, exhaustion is like the deep sense of having nothing left to give. You feel that you're done enough, you're working every day, day out, but still at the end of that, by the time you reach to exhaustion levels, you think that I don't have anything else to give to my patients. Then cynicism, where you start withdrawing, becoming detached from your patients and colleagues and also family members at times. So that's cynicism or a depersonalization. Your own personality, the way you entered into medical field, that completely changes towards other side of your scale. Then even inefficacy, the painful sense of not achieving anything meaningful, no matter how hard you try, that's inefficacy. So if any of these sound familiar, know that you are not alone. And these now aren't signs of any failure. They're actually warning lights. They're telling us that the system and sometimes our own habits need to change. Now, there are 5 stages of burnout. Now, this is a visual metaphor, burning matchstick, which is showing you all for different 5 stages. And it beautifully captures the progression of burnout. Now, let's walk through each stage and the key symptoms associated with each of them. The first stage is called honeymoon stage. We all know about this one. This is the enthusiastic start. Like when we finish our MBBS, when you finish your internship and start working in the first time in the clinical world, this is enthusiastic start. You are full of energy, possibly overcommitting and going the extra mile as well. You actually thrive on the challenges that time and may feel exhilarated. But the warning sign, you're already exerting all your energy with little recovery because in that stage, you're not giving time for yourself to recover mentally or physically. And if it continues to be that, if it becomes unsustainable, then you go to the next stage. The symptoms at that stage is about like your high motivation is there's optimism is there, you're taking on more than necessary work, there's a difficulty to switching off from the work, and you're neglecting your rest. It could be physical rest or a mental rest or emotional rest as well. Then next stage is the stress stage. This is when the cracks start to appear. You begin to neglect self-care and feel the pressure is mounting. You are still coping, but it's taking a toll on you. Symptoms, irritability, you start forgetting, forgetfulness. There is definitely sleep disturbances happening in quality and duration as well. You're feeling anxious or overwhelmed, and definitely the productivity gets reduced as well. Now, the chronic stress stage, next stage is chronic stress stage. Stress becomes your default system. You are constantly fatigued, perhaps emotionally numb as well. You might notice more physical symptoms and unhealthy coping mechanisms start creeping in. The symptoms are like headaches, fatigue, gut issues, binge eating, or a substance reliance, and procrastination or withdrawal, and loss of enjoyment on or the focus as well. Then you enter into the burnout stage. This the flame completely dims. You feel detached emotionally, drained, and maybe absent more often as well. You are no longer yourself functioning, or but far from thriving as well. You're not thriving, you're not functioning. So symptoms are emotional exhaustion, loss of motivation, increased sick days, feeling of isolation. All these come in that burnout stage. Even if you don't tackle your burnout at this point, you will eventually end up into habitual burnout. In habitual burnout, burnout becomes your baseline. You feel very low, unwell, and disconnected, not just occasionally, but chronically. At this stage, intervention is critical. The symptoms are chronically fatigued, chronic insomnia, depression, despair, sense of helplessness, completely disengaging from the work and life as well. The power of this model lies in that you have to recognize it early at the honeymoon stage or even before that. So most people don't suddenly burn out. They slide through these stages. Spotting and supporting ourselves or others early can prevent us reaching the stages of 4 and 5. Most of us oscillate between honeymoon stage to chronic stress stage. As long as we recognize that and we prevent ourselves moving on to next stages, it is good for us. Now, there's another researcher called Faber. One important thing to understand is that burnout doesn't look the same for everyone, as we know. Now, research by Farber identified that there are three subtypes of burnout, and many of us can recognize ourselves in one of these patterns. The first one is called frenetic doctor. He is the one who works harder and harder. He chases the results, refusing to stop until eventually they collapse. It's that relentless drive that becomes self destructive. They are called frenetic doctors. The next is under challenged doctor. He experiences the opposite problem. He is stuck in monotony, bored, losing any sense of meaning in their work, and it's a burnout from disengagement and lack of purpose in this category of doctors. And then there's a worn out doctor or a rust out doctor, they're called. The one who has tried, but after repeated efforts without any reward or recognition, he simply disengages and gives up. Now, each type requires a different path back to health or back to normality. Now, the frenetic type often needs boundaries and recovery. The under challenged need growth and purpose. The burnout needs support, recognition, and re engagement. The first step is recognizing where we are on the spectrum and try to see what we can do from there on. Now, burnout is often thought of as a purely psychological, but the science tells us otherwise. It has a very real biological mechanisms that explain why it's so damaging for us. That's why recovery requires more than just resting. The first one is the hypothalamus pituitary axis dysregulation. In chronic burnout, we see altered cortisol rhythms, sometimes up to 30% variation from normal diurnal patterns. The cortisol awakening response is blunted, and prolonged stress even leads to downregulation of the CRH receptors. In other words, the body's stress system itself is rewired. Now, second is inflammation. Studies have shown elevations in interleukin 6, TNF alpha, and CRP, sometimes 25 to 40% higher than baseline. In some cases, CRP is 2 to 3 times the normal range. Now, this systemic inflammation links burnout to cardiovascular disease, diabetes, and other chronic conditions which we are prone to. Third, autonomic nervous system. Burnout reduces heart rate variability by nearly half. It's a sign of impaired resilience. And sympathetic system dominates, keeping us in fight or flight mode all the time, while the parasympathetic system, which is rest and repair system, struggles even to switch on. So burnout is not just about feeling exhausted. It's about altered stress physiology, increased inflammation, and impaired recovery as well, all of which highlight the urgent need for targeted interventions. Now let's shift the focus to the brain now. Now, because burnout doesn't just affect mood or energy, it reshapes our neurobiology as well. Now, neuroimaging studies show reduced gray matter in key regions. The key regions are prefrontal cortex, the amygdala, and the anterior cingulate. Now, in prefrontal cortex, which is responsible for executive function, decision making, and impulse control. Now, when this is impaired, planning, problem solving, and focusing become harder. And then, you okay? Then the amygdala, our fear and emotion regulator, dysregulation here heightens the anxiety, the emotional reactivity, and persistent feelings of the threat. So the anterior cingulate, essential for empathy, social connection, and conflict resolution. So when damaged, it leads to emotional blunting and reduced capacity to connect with others. Now you can understand the symptomatology which I shared with you in the 5 stages, connecting to the neuro changes here. So the paradox here is that the burnout impairs the very much the brain areas we need most to recover and to regulate our emotions and to build relationships. So if we left it unaddressed, this becomes a self-perpetuating loop. This explains why rest alone isn't enough. To break the cycle, recovery has to be multi-level, combining neuroscience informed strategies, lifestyle medicine changes, and even the coaching approaches as well. Now, if you want to understand a simple way, think of the brain like a computer system. The prefrontal cortex is the processor of the computer. It helps us plan, problem solve, and stay focused. In burnout, it slows down, like a computer freezing when it's overloaded. Okay. Then amygdala is the firewall. It regulates the threats and emotions coming to the computer. But in burnout, it becomes overly sensitive, like a firewall that flags every little thing as a major security threat. Now, coming to anterior cingulate, it's a network card. It allows us to connect with others, build empathy, and resolve conflicts. So in burnout, this connection weakens, like when the Wi-Fi keeps dropping out of your computer system. So in burnout, the processor slows down, the firewall goes into overdrive, and the Wi-Fi gets disconnected. So no wonder why the whole system feels stuck. This is why the recovery requires more than just a quick reboot. We need to repair and rewire the whole system through multi-level interventions. Now, when it comes to understanding burnout, especially in research, clinical evaluation, or workplace assessments, we need validated tools. Now, this slide summarizes both generic instruments and also the specific instruments. Now, generic instruments are there broadly applicable. These are standardized tools used across wide range of occupational settings. The most commonly used is Maslach Burnout Inventory. It's most widely used as well and for researchers as well. It assesses the emotional exhaustion, depersonalization, and reduced personal accomplishment as well. Then is SESQT, which evaluates burnout syndrome at work with a multidimensional approach. Then comes the Copenhagen Burnout Inventory. The recent article which you saw in the newspapers and everywhere in the India, the 1 in 4 thing, all the results are based upon the Copenhagen Burnout Inventory. It measures personal, work-related, and client-related burnout. Then the Oldenburg Burnout Inventory, which focuses on exhaustion and disengagement. Now, burnout clinical subtypes questionnaire is also there, which different phenotypes it's for. Then burnout assessment tool is there. Then Shirom Melamed burnout questionnaire is there. All these are there. And specific instruments, they go for specific occupation like teacher or doctor or a nurse and all that things. Now, this graph is very much important for us. I want you to concentrate for this graph. It illustrates the classic stress and performance curve. It's also called Yarkis-Dodson law, but here it's shown with a more relatable label. And let me break down on this one. On x-axis, we have stress level, like from low to high. On the y-axis, we have performance level and how well we function at work or in life. On the left side of the curve, when stress is too low, we experience something called boredom or underload, which is not enough challenge for us to stay engaged. Now, as stress increases, so does the performance increase. This is the zone of optimal performance, where we are stimulated, focused, and performing well to the maximum. Now, this is where the stress helps. The eustress, the good stress is what we call is this is the zone of optimal performance. Stress is called eustress. But if stress continues to rise beyond the hump, we move into fatigue, then exhaustion, and eventually illness, burnout, breakdown. This is where stress harms us. Now, the key takeaway is that it's not about eliminating stress entirely, but about managing it so we can stay within that optimal zone with enough challenge to stay engaged, but not so much that it overwhelms us. So as long as we every day addresses, I mean, anytime you think your symptoms are different or the way you're behaving is different in clinical or at work or with the family, always think where are you, which zone of performance are you in. Try to help. Try to come back to the zone of optimal performance if you're going to the other side of the zone. And in the same way, if you're going down towards the boredom, try to come up towards the optimal zone so that it keeps you going. Now, lifestyle medicine plays a crucial role here because it can help you through recovery strategies, sleep, movement, mindfulness, and boundary setting. So we can shift back into the sweet spots whenever we need to. Now, we all talk about burnout and stress as common terms, but there's a huge difference. And this slide helps you to understand the critical difference between stress and burnout. Now, stress is characterized by over engagement. We are emotionally involved, driven, and responsive. In contrast, in burnout is marked by disengagement, a sense of emotional numbness or detachment. So with stress, emotions are overactive, but in burnout, they become blunted. We feel very flat, indifferent, or disconnected. Now, stress may drive urgency and hyperactivity, but burnout, however, leads to helplessness and hopelessness. You feel like nothing you do will make a difference. Now, stress causes a loss of energy, whereas burnout results in loss of motivation, ideals, and hope. Now, stress may lead to anxiety, but burnout is more associated with detachment and depression. And finally, when stress primarily affects us physically, burnout causes deep emotional damage to start with. Now, the real distinction which you can keep, the last line which I'm talking about here is stress is when you are drained but still able to recover. Burnout is when you are drained and no longer able to recover between your work cycles. Whatever normal work cycle you do, like 12 hours, 13 hours, whatever doing work wise, if you're not able to recover yourself and going back to next day fully charged again and with the full the zone of optimal performance, that means you're something is going wrong. You have to recover from once you're giving rest to the body and everything, you have to recover and go back to the full performance. If you're not doing that, if there's no recovery, then it means you're getting into the burnout zone. Now, again, this is where lifestyle medicine steps in, not just to manage stress, but to prevent that slide into burnout or by addressing recovery, purpose, and emotional resilience. Now, most of you must have heard about Maslow's hierarchy of basic needs. Now, this is healthcare burnout prevention hierarchy based upon Maslow's hierarchy. This pyramid illustrates a hierarchy of needs for preventing burnout. It builds on Maslow's, showing how burnout prevention must start with basic human needs before addressing higher level motivators. The bottom of the pyramid, if you see, they are basic human needs. Then the foundation, basic human need, like physical needs, like without any adequate rest, hydration, or proper ergonomics, healthcare workers are physically depleted. They lead to get stress and fatigue. Then safety needs also need to be met. Burnout thrives in environments where professionals feel unsafe, whether due to physical threats, psychological harm, or excessive exposure to trauma. Then the middle layers are job factors and operations. Now, efficient workflows, access to the tools, what you require for working appropriately and to the optimal, and proper time management, they all prevent unnecessary stresses. Then job fundamental, fair salary, benefits, career progression, they're all essential for long-term job satisfaction. Then when you go higher, the higher levels, purpose and belonging, the social connections, supportive team culture fosters resilience against burnout. Meaning and self-actualization, like burnout is minimized when healthcare professionals find purpose in their work and passion in their work, whether through mastery or an impact or a career fulfillment, whatever. The key takeaway is that burnout prevention isn't just about resilience training. It requires system level changes as well, starting with the fundamentals and progressing towards the professional fulfillment. Now, this visual captures how lifestyle medicine interventions can be effective across the entire spectrum of burnout prevention, not just after symptoms appear. So let's walk through the whole each stage. In primordial prevention, this is about acting before the burnout even begins. How do you do that? Obviously, by decreasing the risk factors like poor sleep, chronic stress, isolation, and sedentary behavior. So obviously, if you work on all the pillars of lifestyle medicine, you're already preventing primordially. And then think of it as an upstream action as well. Then coming to the primary prevention, at this stage, we focus on identifying early warning signs and reducing the source. Maybe it's a boundary overload or a lack of recovery time or a mismatch between the values and the work you do. Then moving to secondary prevention, now the burnout has begun to develop. We aim to reduce its severity by through personalized restorative approaches like again sleep hygiene, working on them, and coaching, nutrition, reconnecting them with the purpose. Then ultimately tertiary prevention. At this stage, we work to minimize the consequences of burnout. Maybe we can't take the burnout back to normal, but consequences we can prevent, such as depression, absenteeism, or a breakdown through integrated recovery plans, support networks, and therapeutic lifestyle interventions, including referral to psychiatrists or anything needed as well. So key message is lifestyle medicine isn't reactive, it's preventative, it's restorative, and it's protective, supporting well-being, whether you're thriving, surviving, or somewhere in between as well. Oops. So that's why the paradigm shift is needed. When most people talk about burnout, the advice is usually manage your stress better. That's what they tell you. Take a workshop, do yoga, meditate if you can squeeze it in. That's a traditional approach. Now, but here's the truth. Burnout is not simply about stress. It's a mismatch between what the system demands and what human physiology can realistically sustain. That's why we need a paradigm shift here. Instead of just coping harder, we need to thrive smarter here. So lifestyle medicine gives us that evidence-based pillars like nutrition, movement, sleep, stress management, relationships, and substance control. And the PrEP framework, which I have developed it, gives us a roadmap. Like PrEP stands for prevent, rewire, elevate, and perform. I'll talk about it in next slide. It's about moving from a reaction to a proactive, reactive to a proactive transformation. And when we integrate this with work-life alignment, not just balance, but passion and purpose as well, we make thriving sustainable easily. So again, the lifestyle medicine, these are the pillars. They are not just for the patients, they're also for us. I mean, I've already gone through about this slide in the previous ones. So I'll move to the next one. So eating a healthy diet, like obviously all the pillars, each pillar we'll discuss further now. Eating a healthy diet supports mental health and can bolster our resilience against stress-related burnout. The nutrient-rich whole food diets like Mediterranean style eating are linked to better mood and lower stress, whereas poor nutrition is associated with higher burnout. Now, healthy eating may help us to maintain the energy levels and emotional balance during demanding work days, thereby reducing the burnout risk. Now, there are so many evidences are there, but I just for this presentation, I put about two references here. One is Utter et al. In 2023, which was published. It's a survey of 501 hospital staff. Fewer than 40% rated their diet as very good, and 15% met vegetable intake guidelines. Less than 15%, in fact. Importantly, those with healthier eating habits, like more fruits, vegetables, regular family meals to go together, had significantly lower burnout. And again, this suggests better nutrition correlates with less burnout among healthcare workers. Then another study, SQL in 2020, which came out, it review of burnout and diet in clinicians concluded that the diet is a modifiable risk factor here for burnout. Evidence supports again adopting a Mediterranean diet and mindful eating to improve the mental well-being. For example, higher fast food consumption correlates with higher burnout, while a healthy whole food diet is protective, as in the previous article as well. So developing dietary strategies like nutrition education, healthy food access at work is recommended to mitigate burnout in healthcare professionals. Then moving to the next pillar, which is a physical activity pillar. Regular physical activity, we all know, is well-established stress reliever, then that can help prevent burnout as well. Exercise boosts mood, endorphins, and stress resilience, helping clinicians detach from work pressures. Now, in contrast, a sedentary routine can worsen fatigue and emotional exhaustion. Now, healthcare professionals who are engaged in consistent leisure time exercise, they often report better mental health, lower stress, and less burnout. Again, if you look at the evidence, Timulo et al. In 2024, it was a review of 21 studies. They found that healthcare workers who stay physically active face a reduced risk of burnout, particularly showing less emotional exhaustion and depersonalization. Across diverse studies, regular exercise is often associated with lower burnout rates. Now, next one was that Wolf et al. In 2021, a study of again 550 healthcare employees showed that those who spent more time on leisure time physical activity reported significantly lower stress and exhaustion, which are key burnout indicators, as we know. In contrast, a very high job-related physical activity, example, physically demanding shifts, was linked to more exhaustion, highlighting that voluntary exercise outside work is most beneficial. The author stated that physical activity helps workers exit the stress cycle, reducing chronic stress and burnout symptoms. Now, coming to restorative sleep, um, sufficient high quality sleep is essential for recovery from work stress. Lack of sleep impairs emotional regulation and exacerbates fatigue, making the healthcare professionals more vulnerable to burnout. Now, conversely, if you look at prioritizing restorative sleep, 7 to 8 hours, and good sleep hygiene improves mood, cognitive function, and resilience. In essence, sleep protects against burnout, while chronic sleep deprivation is a major burnout risk factor for clinicians. Now, again, looking at the evidences, Santiala et al. 2024 cross-section study of 300 healthcare professionals found that those sleeping less than 7 hours per night had dramatically higher odds of burnout. Now, men and women who slept under 7 hours were about 8 times and 17 times more likely, respectively, to exhibit burnout compared to those sleeping at least 7 hours. Even after adjusting for the other factors, the short sleep remained a significant predictor of burnout in these studies. The authors underscore the critical importance of adequate sleep duration in preventing burnout in healthcare workers. Then the Taylor et al. In 2023 study in French hospital staff showed that a good sleep health, especially feeling satisfied with sleep and being alert during the day, was strongly associated with lower burnout, especially emotional exhaustion scorings. And disturbed sleep or insomnia emerged as a potential risk factor for burnout, independent of anxiety or depression. That is, the researchers suggest that promoting sleep health again should be investigated as a strategy to reduce healthcare worker burnout. Then coming to stress management, effective stress management techniques can directly counteract the chronic stress that leads to burnout. The pillar includes practices like mindfulness meditation, yoga, breathing exercises, counseling, and cognitive behavioral strategies. By regularly engaging in stress reduction activities, healthcare professionals can lower their anxiety and emotional exhaustion, increase the coping skills, and prevent minor stress from escalating into full burnout. In short, building stress management into one's routine enhances resilience and psychological well-being as well. Now, coming to evidences, again, Park et al. In 2023, systematic review and meta-analysis of nurse burnout interventions found that the MBSR, which is a mindfulness-based stress reduction program, were the most frequently used and showed significant efficacy in reducing burnout levels. Now, nurses who participated in mindfulness or meditation interventions experienced improvements in burnout. Meta-analysis data showed that mindfulness training is an effective approach to improve healthcare workers' well-being and also to mitigate the burnout. Then the meta-analysis from 2017 to 23 studies, numerous studies report that structured stress management interventions lead to meaningful reductions in burnout among clinicians. For example, the programs teaching coping skills, relaxation techniques, yoga, or CBT all have been associated with decreased burnout scores. Now, these interventions likely work by enhancing providers' resilience and emotional regulation, thereby buffering against the work stress. In practice, combining individual stress management like mindfulness sessions with organizational support can yield the best burnout prevention outcomes. Now, coming to the strong social connections here, they also support networks. I mean, they also are very protective antidote to burnout. The healthcare professionals who maintain supportive relationships, whether with colleagues, like a team or mentorship, anybody, friends, or even family, they tend to cope better with job stress. Emotional support, empathy, and a sense of community can reduce feelings of isolation or cynicism at work. Thus, nurturing social connections both in and out of the workplace helps us to blunt the impact of chronic stress and reduces the likelihood of getting into burnout stage. Again, a lot of evidences. Rivsito et al. Study of nearly 1,000 physicians and nurses found that social support significantly buffered the impact of burnout on health outcomes. Uh, and also, the protective factor studies have shown reviews consistently identify social support as a key protective factor against clinician burnout. For instance, healthcare workers who report higher levels of support, like from peers or supervisors or even family, they may have lower burnout rates and stress levels as well. Conversely, poor support or loneliness is associated with increased burnout risks. These findings suggest that fostering a supportive workplace culture and encouraging social connections can substantially improve the provider's well being. And coming to avoiding risky substances, avoiding harmful substances like tobacco or excessive alcohol or drugs helps maintain physical and mental health, thereby reducing burnout susceptibility as well. Now, stress and burnout can sometimes drive healthcare professionals towards some maladaptive coping behaviors as well, like heavy drinking or substance misuse, which only worsen the fatigue, depression, and cognitive impairment. Now, by abstaining from or minimizing alcohol and other risky substances, clinicians can prevent these substances from exacerbating stress and ensure that healthier coping mechanisms are used instead. Now, again, there are a lot of evidence there. A national survey done by Jackson et al. In US medical students found a strong association between burnout and alcohol misuse. Now, burnt out students were significantly more likely to meet criteria for alcohol abuse or dependence. Now, in multivariate analysis, burnout was an independent predictor of alcohol abuse, suggesting that distress from burnout may lead to unhealthy drinking as a coping method. Now, this link indicates that addressing burnout can in turn reduce substance abuse and vice versa as well. So other surveys, other research echoes the connection between burnout and substance abuse as well. For example, a study of orthopedic surgery residents noted that alcohol and illicit drug use can worsen burnout and depression. So that's about the risky substances. Now, PrEP. So as I told you, it stands for prevent, rewire, elevate, and perform. So how do we move from coping to thriving? Now, this is where my PrEP framework comes in. And I have been using this framework because I'm in charge of the foundation year doctors who might coach for burnout prevention as well. And also I'm NHS faculty for conducting health and well-being workshops for other doctors, senior doctors as well. So where I use this whole mechanism of PrEP as well, and I've seen a lot of effects, a lot of impact and better outcomes as well. So it takes that. Now this is where my PrEP framework comes in. Actually, it takes the pillars of the lifestyle medicine and translates them into a practical roadmap for recovery and performance. The first step is prevent, spotting the early warning signs of burnout before they escalate. Just like we screen for hypertension or diabetes, we need to screen for stress and burnout. Now, my doctors, the foundation year doctors, what I do is every month they fill up this Copenhagen burnout inventory forms. So I can see them because I'm director for them. I can see their scores. If any scores going up or down, I always have a one-to-one meeting with them and then discover what is going wrong, and then try to help them and coach them for a better life in the professional life at that level of their training. Then second step is rewire. Now resetting the stress circuits here. This is about retraining the brain and body, calming the overactive stress response, and building new healthier neural pathways. Now next is elevate, building vitality habits here. Here we focus on nutrition, movement, sleep, social connection, the foundations that elevate energy, resilience, and well-being. Finally, perform. Now, thriving with renewed purpose here and passion. This is about aligning your passion and purpose so performance feels sustainable, not draining. So PrEP isn't just about surviving burnout, it's about reclaiming energy, rewiring resilience, and performing at our best, both in medicine and in life as well. Now, if you want to see the PrEP in action, the beauty of PrEP is that it's not just theory, it's something you can live and repeat daily. In the prevent phase, it's about awareness. For example, notice when your sleep gets disrupted or when irritability starts creeping in. These are early warning lights, just like on a car dashboard. In Rewire, we use micro resets where something as simple as one deep breath before entering to see the next patient's room it can reset your stress response and help you show up fresh to the next patient. In Elevate, we add small vitality habits, things like walking meetings or choosing nourishing food at lunch at work, small steps that lift energy consistently. And in Perform, it's about showing up with presence and passion, not exhaustion. When we have prevented, rewired, and elevated, performance becomes natural and becomes sustainable as well. That's why this PrEP is powerful. It's not an abstract idea, it's a lived, repeatable framework for thriving. Now, even the best lifestyle strategies can't survive if we are working in a toxic environment. So you can meditate, you can exercise, you can eat well. But if you're afraid to speak up at work, those strategies will always hit a ceiling. That's where the psychological safety comes in. Psychological safety is the belief that we can speak up, we can make mistakes, or ask for help without fear of humiliation or punishment. Then it has trust. You have to have a trust for that, confidence in our colleagues and in our system to work within. Those are the three foundations: trust, voice, and belonging for this psychological safety. So voice is that freedom. We should have a freedom to express our concerns and also our ideas very openly. Then belonging, we should feel valued and included, not just tolerated. When those are present, when these are present, something powerful happens. We don't just survive there at work, we also start innovating, we also connect deeply, we also start growing. That's why I believe true transformation has to be both individual level and organizational level as well. It's not enough to just focus on self-care. It's about lifestyle medicine plus prep plus psychological safety. That's the formula for real flourishing. So it's a good news. Burnout is not the end of the story. It can be doorway. We begin in burnout with exhaustion, cynicism, and inefficacy. That place where we feel we have got nothing left to give, but with the right tools and support, we can move into the balance. What do you mean by that? Finding stability, recovery, and renewed energy. This is where rest and restoration help us to get back to neutral. But the real opportunity is in becoming, where we thrive, rediscover our purpose, and transform into our best selves beyond balance, but into growth. So the journey isn't just from burnout to survival, it's from burnout to balance to becoming. So we have covered a lot today, I think, but change only happens when we take action, isn't it? So here's my invitation for you tonight. First, choose one lifestyle medicine pillar to start with. Maybe sleep, nutrition, or movement. Don't try to do everything at once. Start with one. Second, apply prep. Use one micro tool this week. It could be a single deep breath between patients or noticing when you are starting to lose sleep. Small resets make a big difference. Third, build connection. Share your journey with just one colleague. Connection is protective. It reminds us we are not alone in this. And fourth, create safety. Tomorrow, ask your team one question that opens space for honesty, like what's one thing we can do to support each other better this week? That's how psychological safety begins. Small steps, big ripple effects. That's how we move from burnout to balance to becoming. So as we close, I want to leave you with this reminder. Burnout is not inevitable, and success doesn't have to mean sacrifice. Flourishing is possible. Together we can move from exhaustion to excellence, not just surviving medicine but thriving in it as well. And my hope is that we build a future where healthcare professionals don't just get through the day but truly flourish with passion, with purpose and balance. And thank you for being here, for the work you do every day, and for being part of this movement towards a healthier profession. Thank you.
Sir, it was a wonderful talk. I could, connect to a lot of symptoms of burnout at different stages of my career when you said, and it's something which is like an elephant in the room and not spoken about, especially in the Indian healthcare. And I see my residents. I'm a visiting faculty at JJ Group of Hospitals, Grant Medical College. And I see that, the concept of work-life balance is missing. And the number of hours the residents are putting in, even the fellows are putting in, is absolutely huge, and the junior faculty. So thanks for this amazing approach. You know, I have a few questions, when I was listening to you and going through your book, which is one habit would you recommend to, tackle or prevent burnout that we should compulsorily do each day? Because there are multiple strategies which you have written, but one thing which you feel is the most important.
For me, it is asking the question why you entered this profession every day, or when you feel low, ask why, because that actually keeps it going, isn't it? Because when we took MBBS seat, I think that was a time when we are so much enthusiastic and so much passionate about this field. And as we progress towards our career, we all start losing that. We try to see different markers in life to be happy. I think keep that one anchor, like why I'm doing this, why I'm in this profession still. Is it giving me the happiness and the success which I actually came into for? And I think that question always you ask, then you'll have more verticals to that question. Then you can probably work on them. I think that's what I feel. Yeah,
I believe, that was a wonderful way of putting it in, understanding the why we have chosen this profession. And, it just simplifies things for us because
exactly.
then we don't have to run behind numbers or anything. We have to
I think
just, you know,
because the markers are different, because the community around us tells you to mark yourself against this, and we lose what we were aiming for, why we came into this. And everybody talks about work-life balance. I don't tell them, don't say balance, because balance immediately takes you to that work should be 50% and life should be 50%. It is not that way. Every day we can put 70% of work, and sometimes we put only 100% of work, or sometimes we don't put any work. That's fine. So the better term for that is workplace integration. And success is not only workplace integration, success is actually work, life, purpose, and passion. These four things. I mean, then my next tip was that only actually, when you asked me the tip, one was why. Second thing is you measure your parameters in four different domains: work, life, purpose, and passion. We usually keep purpose and passion for post-retirement life, but that is not needed. I think you can start doing even now. Like even if you do 1 hour of charity in a whole 1 week, that's your purpose. And something passionate, like we all medical people, we get into the medicine at very early age. We don't even know what other things we could have actually flourished in. So we all have our inherent something good, maybe something which we can develop other than medicine, which we might have forgotten, or we might not have discovered as well. So that becomes your purpose and passion. So try to find out in four domains every day or every week. Sit down and do the audit and see where I can develop more. So once you start developing this, like more like ikigai, like how you people know about ikigai. So it's more that, but I've more simplified it. Like work is work, it's not life. Work is part of life. Then life is life, like giving time to yourself, family, friends around you, anybody. Purpose is why you are here. Like that's why of your profession, why of your life as well, like what you want to do, what you want to leave something behind. And then the passion could be in different skill sets. Somebody wanted to become a musician, somebody wanted to learn piano, somebody wanted to do dance, or somebody wanted to do action, anything for that matter. So yeah, I think you have to sit down with yourself. If you don't give time to yourself, you'll never know what else you can do in life. Sorry, I think I cut your question. Sorry.
no, no, I believe what you said makes so much sense. And, we have got one audience question also.
Okay.
Uh, Dr. Jija is asking, what type of journaling do you recommend?
Anything which is easy for you to do. Some people write three things. Like there's a lot of evidence on positive psychology studies that even if you, before you go to bed, if you put three things which have gone right in your life that day, today, that's enough to actually mount resilience, like some points earlier, like on the higher side, when you actually calculate the resilience scales after a month or two. So 3 points, start putting three positive points. Now some people are in a habit to write in a book. Some people record voice recordings and delete them because they don't want anybody to know what they're doing. Same with the paperwork in the journal as well. You want to write the three things. As long as it is gone onto the paper, you have offloaded your brain. And similarly, there is something called as a brain dumping method, which probably most of you know. One is writing good things is journaling. It's good journaling. The brain dumping is writing bad things which have happened to you that day. It's a dumping, like dumping into the trash. So it helps. There's evidence for it as well. So brain dumping also works in similar way. Write in a paper, record in a video, and delete them. Finish. So you're going back to the bed by dumping everything which was bothering you whole day, bothering you or making you happy as well, both. And that if you practice for 7 days, you will see on the eighth day you will be waking up very fresh, good quality of sleep. Everything gets better. So that's what I do about journal. Again, it comes to your own, to you, your life, what you can do. For your own lifestyle, you have to change it, not copying anybody else.
Hmm. Uh,
That's
uh,
so wonderful, sir. My spiritual mentor calls this catharsis. You write the frustration on a piece of paper, then just tone it and throw it in a dustbin.
Yeah,
So that is so awesome. Yeah. Another thing, what you said, about life, work, purpose, passion, integrating everything and not thinking about the balance is so important. Nowadays I see a lot of, my contemporaries, my friends, especially from other uh, professions also talking about FIRE, financially independent retirement early. And then I speak to some of the accomplished doctors who are, they look very balanced. They look mature and they are just enjoying their profession. And I was speaking to my mentor a couple of weeks back, and they don't think about retirement because they are enjoying their work. There is the stress element
exactly.
per se is not their day-to-day basis, and they live each moment when they're treating their patients and doing
Yeah.
work. So purpose and passion incorporating in our daily routine life is so important. Well said, sir.
It is important. I think even if you start with 10%, that's fine. But as long as doing it every day as a part of the routine, I think that helps you. I think this is my own personal experience. I am an anesthetist and I used to work in intensive care. I'm still work as well intensive care. And 6 years or 7 years now, I think before COVID, I was so burnt out already because of anesthesia on calls and the way we work and everything. Plus the COVID hit. Then I was working in intensive care unit with so many COVID patients with all the masks, everything wearing every day for 8 hours, 10 hours continuously, and seeing all the emotional things happening there, people dying, young patients are dying, older patients are getting alive, I mean, staying alive, but in intensive care, all these things, so many things were going on in our minds, everything. But I can't just leave the job and just say I'm just going. Obviously, I had to find something out. And this is what whatever I'm telling now and what I'm teaching is all things which I do. And that's how I can do so many multiple things. I'm still doing. I never feel burnt out. Because all things which I do are part of these four domains. It's life, work, passion, purpose. Everything is combined together. So that makes huge difference because you always try to go, okay, does this give me anything financially or does it give me anything in return if I do this? No. When you start doing, like, passion and purpose is always pro bono. You try to do it on your own because you get more than what you do actually. People don't realize it.
Uh, Again, sir, true. So, what's your take on mindfulness or meditation practice in routine life? How useful is that?
Yeah. Again, there's a lot of evidence for mindfulness-based stress reduction protocols. You don't, it's just like I always compare it to the physical activity levels. Okay. Somebody who can't even walk or just they're very sedentary, they should start walking first. Other, if you tell them to go and meditate, who doesn't even actually being mindful in a day-to-day routine, it's a complete no-no because it's too much overwhelming for them. Okay. So I always tell people, okay, somebody who comes to me doesn't know anything about meditation or anything, I tell them, okay, you don't know anything about these things. I'll ask him, what is the one thing in your life which you enjoy the most? What I mean of that is, like, during while doing that activity or while you're involved in that kind of work, when you forget what's happening around you, what is that one thing you can tell me? So everybody has their answers, three, four answers will they have. Somebody says watching a football match, for example, or somebody says watching a movie or playing a guitar or playing a piano. So there they are already mindful, they're practicing mindfulness in that activity. So they don't have to start from zero. They're already on 70% or 80% mindful there because some people you might have seen, they're watching a movie or doing some activity, whatever happening around them, they're not bothered. Even if you call their names, they might not answer to you. That's dana, that's mindfulness already happening there. It is not that you have to be sitting in a room where nothing is happening and you can meditate. No, you have to be mindful around the chaos around you actually. So if you ask yourself, Dr. Modi and Shruti, you'll know there's some things which you think when you're doing those things, you're completely involved there. So everybody should pick up that one or two things of their life that they're doing, one, and start doing it from 70 to 100. Like completely, be completely mindful there. If you really want to play music, go and play music, fully get involved and do those things. Or you want to just listen to music, again, that's the mindfulness. As long as you are completely involved without any judgment, that's where it comes. And then you can build it up. It's just like walking and then start running, and then you take marathons. Marathon is like our meditation, like you go to meditation practices and all those things. So always compare it and tell them, then it becomes easier for them to understand what I'm saying to them. If you directly tell them no, you can't meditate because you can't concentrate, then it's overwhelming for them. You can't convince them to do that. So yeah, that's my take. Sorry.
Yeah, no, that's wonderful. One of the key takeaways which I personally got was, you know, during the foundation year itself, you are, starting a preventive burnout prevention for burnout program and monitoring the residents and the young
Yeah.
doctors. And if the scores are dropping, then speaking to them one to one. I believe
Yeah.
that also directly impacts patient care in a very positive way.
I mean, I mean, profession has become so bad that people might want to leave profession, not only in any UK or India or America, anywhere for that matter. So it has become more occupation.
Hmm.
Occupation is 7 to 8. Like if 9 to 8 or 8 to 8 you're working, 8 o'clock bell rings, I have to go. It's occupation. But we're all professionals here. If you're seeing a patient at 8 o'clock, you still have to see patient till we finish that patient, isn't it? So that is missing. I think unless you bring that interest back to them, I think a lot of these resident doctors who come directly from medical school to direct first year of responsibility, there is lot of identity crisis.
Hmm.
They don't know what they're doing. Plus, overwhelming with so many things happening around them. Nurses asking this, other doctors are asking, senior doctors are asking this, everything. So somebody should be able to tell them, okay, this is the path you should walk. There are a lot of books to read about medicine, to practice skills, to interpret blood results, to interpret ECG, but nobody wants to tell these, which this is what I'm trying to do through my small cohort of doctors whom I care for, so that they can take it further and do things. I'm sure, Dr. Rohit, you can probably start doing from tomorrow because you got so many resident doctors there with you.
I believe it is so important because a couple of months back we lost a resident in pediatrics due to suicide, and later on it was we realized it was due to burnout. So what you said was there is nobody to give them a roadmap to make them understand that how to go
Yes,
about. And you know when I am out of the residency program 10, 12 years into practice, I realized some of the things which I was really worried during that time during residency doesn't even matter now.
exactly. So that's why, unless it comes from you as an experienced doctor in the who can look up to you, and they when you tell them, okay, concentrate on these things, don't worry about other things, it makes a difference. We always tell them, "Oh, what have you done? Present the case, do this, do that." So I think that somebody should be able to tell them that, or at least some things different. Yeah.
So one of the questions which have come in the chat section is how many minutes of meditation would you recommend daily?
Again, it's just like asking, can I run marathon or can I run for 5 miles, 10 miles? Again, it all depends on your capacity. As long as you can concentrate in that, be mindful, be in that position without getting interrupted, or you can do it, keep doing. I think, but again, you can see CT and MRI changes in the brain when the people are meditated for 30 minutes, for 60 minutes, and all that. But again, we don't really need that. Everybody doesn't have to be a marathon runner. 30 minutes of physical activity is enough for most of us to prevent chronic diseases.
Right.
Similarly, whatever mindful activity, however minutes of meditation you want to do, do it. It will add only. It will not, I mean, as long as you can manage the time, do it. Don't quantify it. The quality is different. The quantifying is different. Yeah.
Sir, it was an amazing session. I would really like to thank you on behalf of Pan India, and a personal note of thanks because
Thank
a
you.
lot of things in the presentation, I read your book, but when I heard you live, I could connect at my personal level also what burnout felt and how some of the things has helped me to keep me active and focused. So really thank you. And I would personally recommend the books written by Dr. Sunil Kumar. It is so simple, easy to implement, And the
Yeah,
action plan of 10 weeks is absolutely amazing.
there's a small correction. I think this was meant, it was written for the community, like people in the community where the scientific things, but translated to patient understanding language. That's what I did it for. I mean, most of the doctors might feel it's so simple, but yeah, I'm just telling that. That's it.
So
We will.
certain simple things are, the most important things in life.
I know. Thank you. Mhm.
Thank you. Thank you.
Sir, actually, this was the very first time that we had the opportunity to host a session on such a topic in our webinar. We never host such topic. We always do something around plant-based nutrition, evidence-based nutrition. And
Yeah.
your presentation was truly wonderful and very insightful, clear and enriching.
Thank you so much, Shruti. Thank you. Thank you for inviting me. And thank you, Regina. I know that she's here or not today, but yeah, thank
She,
you.
she she joined us, but she left, and I'm sure many of us will reflect on our work and real
Please do.
life practice today before we go to sleep. Thank you.
Yeah.
And
Thank you
thank you,
so much.
Dr. Modi, for
Thank you.
graciously taking time out of your busy
Thank
schedule to host this webinar. The first time I asked him in a 1 second, he said, Yes, I will host this webinar.
Thank you again, Dr. Modi. Yeah, thank you.
Thank you, everyone. Thank
Thank
you.
you. Have a lovely night. I mean, it's already late for you guys. Yeah. Good night. Yeah. Thank you so
Good
much.
night.
Night. Bye bye.